Mother is concerned that 18-month-old son has a vocabulary of 10 words but cannot form a sentence. He walked independently at 14 months and likes to play with older brother. What is the best management strategy? This is normal development. This child has good number of words at 18 months. By 2 years, children should be joining words together to form a short sentence. Children should walk before 18 months age. Mother presents with 12-month-old daughter who has no meaningful words, is unable to sit unaided, and cannot play with her toys. She does not laugh and has poor interaction with her siblings. What is the best management strategy? Okay, so there are developmental disorders here. Children should sit unsupported by 7 months, and 12-month-old children should be playing with toys. She is not interacting with siblings, so may have sensory problems. So the child needs to be assessed by a developmental pediatrician. 4-year-old boy is brought by parents as he wets the bed at night, and also sometimes when he's excited. What would be the most appropriate management advice? Reassurance, as any child under 5 can wet the bed and do not need any intervention. 6-week-old boy is brought with profuse projectile vomiting. What is the appropriate initial investigation? You would be suspecting pyloric stenosis, so you need to look for low potassium and high urea. 4-month-old girl has increasing jaundice, which was first noticed at 1 week of age. She has failure to thrive, has enlarged liver and scratch marks on her skin. Parents had been unable to seek medical care. What is the most likely pathology? So this girl may have biliary atresia and has obstructive jaundice, which is giving rise to enlarged liver and also leading to itching. 6-year-old child presents with fever, cough and drooling of saliva. On examination, he is febrile and has stridor. X-ray of neck in extension shows a thumb sign. Choose a single most appropriate diagnosis. Acute epiglottitis can be seen as a thumb sign in a lateral X-ray of the neck. 1-year-old child aspirated foreign body which needed endoscopic removal of hospital. Parents are now asking how to help a choking child if this happened at home. What first aid action will you advise for a child who is conscious but not coughing effectively? So you need to know the choking algorithm from Research Council UK. If a child is coughing effectively, just encourage them to cough. In a small child who is not coughing effectively, you will give alternate 5 back blows and 5 chest thrusts. Mother brings her 2-year-old son with 1 hour history of noisy breathing. She states that although he had mild coryza over the last week, he was improving. So they had gone to a children's picnic. Another parent found him coughing and spluttering, and ever since his breathing has remained noisy. Though he appears well in the ED, his current observations demonstrate a raised respiratory rate and saturations of only 91% on air. What is the most likely diagnosis? This is an important differential. The most likely diagnosis is foreign body aspiration because the noisy breathing was sudden in onset and has remained same. Yes, a child could have had anaphylaxis, but that will have a systemic reaction with swelling, low BP, flushed appearance. Croup is slowly progressive but happens within a few days of coryzal illness. In this case, he was improving. Epiglottitis will have high fever and drooling, and the story does not sound like asthma. 1-year-old child is brought to ED as he woke up in the middle of the night crying severely. He is waiting to see a senior doctor. What initial measure should be taken for managing this child? You could give analgesia until a senior is arriving. 8-year-old child presents with recurrent abdominal pain, occasional headaches, but maintains a good appetite and growth. Examination is normal. Tests show normal full blood count and normal urine electrolytes. What would you do next? Reassurance. As we have not found any serious pathology on examination or on initial tests, it is possible the child has abdominal migraine, but investigations or surgical referrals are not required.